Mayo Clinic says 12.4% of the US population suffers from an anxiety disorder. How about you? Anxiety is more than just a feeling or a small tremor. It's a force of nature. It can be controlled, however, when a person knows the signs, symptoms, and coping skills to combat this silent illness. It all starts with the calm before the storm. Most people have felt anxious or worried in their lives. However, people living with anxiety disorders have feelings beyond their control. They begin, according to the American Psychological Association, with physical signs such as increased blood pressure, sweating, trembling, dizziness, and/or rapid heartbeat. They also have other signs of anxiety, including feeling as though they have lost control, extreme tension, out of control reactions in proportion to the situation at hand, and feeling as if something is about to happen or go wrong. These are all signs of an ensuing panic attack. There are ways to avoid this, however. Start by breathing deeply. This will lower the heart rate and ease dizziness. Focus on subtle details of your surroundings. What is the color of the walls? What time is it? What color is your shirt? How old are you? Also, try to remove this person or yourself from the situation that caused this wave of anxiety. Try going for a walk, maybe even asking somebody to join. Try as hard as possible to stay with somebody. If someone with anxiety is alone, the situation may escalate quickly. Now, let's say this person or you couldn't get control of your anxiety. Now what? This has went from a wave of anxiety to a full panic attack. What is a panic attack? The National Institute of Mental Health states that a panic attack is a sudden period of intense fear. This is what a panic attack is like. You have heart palpitations, or your heart feels like it's pounding out of its chest. You're sweating profusely, you tremble, you feel as if you're going insane or the world is going to end. You may also feel like you're dying. This seems like a lot to deal with at once, and it is. But if you see someone exhibiting these symptoms, here's how to make this attack less destructive. Begin by asking the person if they are okay with contact. If so, brace them in some way in case they fall unconscious. If not, make sure that they are in a safe, stable situation where they cannot hurt themselves or others. Then, distract their mind. Ask them their name, their age, when's their birthday, what's their favorite color. Try anything you can to get their minds off of the insane amounts of anxiety that they are feeling. Now, this is more than likely the most important thing I will say. Make sure they breathe. Have them breathe as deeply as possible. If they say they can't, continue to breathe with them or continue to ask them questions. This will either or cause them to breathe deeper as time goes on. If they are hyperventilating, try as hard as you can to slow their breathing down, and if you cannot, brace for them to fall unconscious. Now, you have survived the attack. You feel relief. But is it really over? This is what is called the aftershock. After panic attacks, people feel drained. They also feel embarrassed and sometimes even ashamed that they had the attack in the first place. If a person chooses not to seek treatment, it may not just go away like the common cold. When people or a person has a panic attack, in some cases, the panic attack will be caused again just by being in the same location that it started. Even if it seems embarrassing or if you don't want to tell a soul, the Anxiety and Depression Association of America, or ADAA, says the disorder is highly responsive to treatment. This means the more you seek treatment, the better it will be and the better your life will get. There are many websites and doctors that can help combat this disorder. Seek help if you need to. And now it is time to rebuild. Anxiety disorders may be more common than people like to think, but unlike an earthquake, it can be controlled.